Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, our preparations for the upcoming Gold Midwifery Online Conference of 2020 are in full swing. And before the conference, we like to get together with our speakers and chat a bit about them, what they're up to, and their professional journey, and as well as the presentation that they will hold for us here. And with me today is a speaker from our add-on package of perinatal nutrition, Dr. Jus Crea. Welcome, Dr. Jus Crea.
Thank you for having me again.
It is absolutely wonderful that you are back with us here today and that you're presenting again here at Gold. When I heard that you were back, I was so super excited because listening to your presentation from last year, I felt, oh, I want to learn more from her. She has so much knowledge and wisdom to share, so I'm grateful that you're back with us this year as well.
Thank you so much.
And so for our listeners now, Dr. Jus Crea, let them know a little bit about yourself, the ones who have not been able to listen to last year's presentation. So tell them you have quite a fascinating background and professional journey. So tell them a little bit about yourself here.
Sure. So I'm a naturopathic physician by practice. I've been in private practice since 2005, and I specialize in women's health and children's medicine. I primarily use herbal medicine and homeopathy and clinical nutrition. I was actually a professor of nutrition at one point in time. I also am Penobscot, so I'm indigenous, and I've really loved to practice indigenous midwifery and traditional birthing. So I come from that perspective with women's care and birthing.
Wonderful. Thank you for sharing that. And I think it's wonderful that you're sharing the knowledge of herbal medicine and the traditions and wisdoms of indigenous midwives. That got me thinking, and you were talking about that last year too. Not long ago, I saw a documentary, and unfortunately, I do not recall the name of the documentary, but it was about indigenous people and how elders are trying to preserve traditions and also medicine. It wasn't specifically about midwifery. And I got to think, oh my goodness, if when they are gone, these elders are gone, what happens to the language, the traditions? But you are involved in this. So can you tell us a little bit about your community?
Right. So I am Wabanaki. We're from the northeast region of America. So my tribe is Penobscot, and we're located in Maine. I do quite a bit in reclamation of our birthing, our medicine, our traditional knowledge and ceremonies and spiritual ways, and I also do a lot with reclamation of our language. My great-grandmother, when she passed away, was one of the last primary speakers of our language, and so it's really important for me and my two children that we do this work together in reclaiming our traditions and language. It's really important to me.
Beautiful. Thank you for sharing that as well. And do you see, I mean, I'm practicing here, I'm living in the south of Florida. There is kind of a rediscovery of the old ways from what I can see here amongst midwives and birth workers, at least like home birth midwives and out of hospital midwives and some traditional midwives or midwives in hospital settings as well, that they're rediscovering the herbal herbal remedies and the old ways of birthing, the traditional, the uninhibited ways of birthing. So do you see that too in your community?
Oh yeah, so I actually teach quite a lot about this as far as our history and what's happened with colonization. So with colonization, it was actually against the law for us to practice our religion all the way up until 1978. And so when we look at traditional birthing and using plants as medicine, it was really incorporated as our religious rites, as was speaking our languages were forbidden as well. So with colonization, that was all forbidden. So that's why we're seeing this resurgence now since these illegal laws have been lifted and since the government has stopped their persecution,
Mhm.
we have the freedom now and to basically not have to go underground to be able to practice our medicines and speak our language and so forth.
Thank you.
Yeah, my grandmother was abused quite a bit for speaking her language. So that's why today we see this resurgence.
Yeah. Horrible history there, and thank you for sharing that and also your good work there in the area as well. Um,
Thank you.
Now let's talk also about your presentation, and this is an exciting topic here, the importance of gut flora in perinatal nutrition. And in recent years, we're learning so much about the microbiome and the gut, and I feel like every day this is so exciting. Every day there's new research out and new information coming out, but I still feel we're like still scraping just like at the surface of this. So tell us a little bit of what you discovered, what you when you were learning about this topic, and how you got
Yes.
involved into this as well.
Yeah, so in my practice, probiotics in a naturopathic medicine, we always said, healing the gut was at the forefront of all chronic disease. And so we know today how prevalent chronic disease is. So in my practice, gut flora and balancing the gut flora, which we're going to talk about, is like what I do every day, all day long for people because our gut flora is so assaulted. So in pregnancy, especially here, we really dive into the importance of this gut flora in perinatal nutrition. And in my research and putting this together, I was astounded by how much, just so much recent studies and the impacts that it have is just amazing.
Mm,
Everything from preventing high blood pressure and preeclampsia and gestational diabetes and preterm delivery to infections to the health of the infant. I mean, it's just of utmost importance. So it's really fascinating and really to me, the most important thing we have here and it's just amazing how much information and how many studies and how much research is coming forth now.
And it's such an important topic as you said, because so many diseases can actually be prevented if the gut
Exactly.
flora is balanced. Yeah.
So with the infant, with the healthy gut microbes, you can prevent allergies and eczema and asthma and obesity and diabetes and mental health, ADHD and autism. So much of the neurocognitive development of the infant, the immune system. I mean, it's the foundation of pretty much everything as far as all the systems and health of the baby and the mom.
Wonderful. Yeah. And so there is definitely a lot a pregnant woman can do, right? It's not like, okay, if
Yeah.
you had a really bad diet, okay, you're doomed, but there is ways to improve this, right?
Right, and that's what I do all day long in my practice, helping people balance the gut microbes.
Right.
Yeah,
And,
so
and,
we're going to
and
talk a lot about
probably there's a lot of education to be done too, right? I mean, it's probably not as easy to say, okay, here, take a probiotic and you're fine, right? So you probably have to do a lot going backwards and teaching them not in because we always hear, oh yeah, you need to eat healthy and kind of, that for pregnancy this is important, but there is probably a lot of unlearning you have to do with your patients, with your clients as well, right?
Right, and then also just the day-to-day impacts of what the poor diet eating is doing to the flora and their health, but also potential interventions as far as formula feeding or cesarean sections or antibiotics and how that's impacting the flora, and then what to do going forward to help rebalance that is really important.
Right, right. So before I let you go here, and this is maybe a little bit of a tricky question for you, but so for let's say for the birth worker out here in the field, the midwife, and we're excited to learn about this important topic about the gut flora, but what if one of the midwives says to you, "Oh, I really want to do it all, but I'm so busy, and this is I feel like a little overwhelmed with this topic. What can you tell me? How can I get started without feeling overwhelmed? But I want to give good guidance to my clients."
Right. So I actually put probiotics as importance as just a general prenatal vitamin. So I'm
Mhm.
going to go through some like the basic supplements for a healthy pregnancy.
Mhm.
For me in my practice are a prenatal, a fish oil, and a probiotic.
Mhm.
So for me, it's that important to list right up there with the top three as far as supplementing in pregnancy.
Right. Perfect. Wonderful. Thank you for that information. And Dr. Jus Crea, it was wonderful chatting with you here today, and thank you for your time.
Thank you so much.
And for our listeners now, the presentation, The Importance of Gut Flora in Perinatal Nutrition, is part of the add-on lecture pack about perinatal nutrition. And this pack will be live, or it will be available, I should say, on February 4th of 2020. And if you would like to find out more about this presentation, about Dr. Jus Crea, and about the other presentations in the lecture pack, we invite you to go to our website. You can go to goldmidwifery.com and also to goldlearning.com. Thank you, everyone, for listening here with us today. Bye-bye for now.